Hi, my name's Michelle Gellis, and I would like to thank the American Acupuncture Council for giving me this opportunity to speak to you today about the importance of clearing blocks before facial acupuncture treatment. I am an acupuncture physician, and I am on faculty at Yosan University in California. I'm on the doctoral faculty, and I taught at the Maryland University of Integrative Health from 2003 until 2021. And I teach facial acupuncture classes internationally. So, the first thing I want to discuss is what is an energetic block? So, energetic blocks are um, a break or an impediment to the smooth flow of qi in the body. And left untreated, they can prevent treatments from being effective, or if they are effective, they can prevent the treatment from holding. So your patient may get better and then they get sick again. According to the Ling Shu, it says that only when the stagnation is cleared away can the channels be vented and yin and yang can be harmonized. And when we're thinking about facial acupuncture treatments, whether it's for a cosmetic purpose or functional, some sort of neuromuscular condition, um, the purpose of doing these treatments is to send blood and qi up to the face and neck and head. And if there are blocks to treatment, then the energy cannot flow up to where it needs to go. So I'm a classically trained Worsley 5-element acupuncturist, and one of the first things that we do when we start treating a patient is to clear blocks. And today I'm going to talk to you about possession, which is internal and external demons. And I am also going to talk to you about aggressive energy. And this is part one of a two-part lecture. Next time, we are going to talk about husband-wife imbalances and entry-exit blocks. The reason why clearing blocks to treatment is so important when we're talking about treating the face is typically when you perform cosmetic acupuncture, you are using a lot of needles, and there can be a risk, an increased risk of needle shock, which can manifest as your patient not feeling well, breaking out in a cold sweat, nausea, and in very extreme situations, a loss of consciousness. By clearing the blocks prior to doing your facial acupuncture treatment, it allows the qi and the blood to uh, flow through the channels and prevent any sudden shifts in energy, and therefore reducing the risk of needle shock. So the first thing I'm going to talk about is how we diagnose blocks to treatment. And the very first block that you would want to check for is possession. And possession, the diagnosing and treating of possession dates all the way back to the Su Wen. And the only way that you can know if your patient is possessed is through a lack of Shen in the eyes. You might suspect it based on their life history, stories they tell you, the way they look, but really, if you are looking at your patient and the lights are on, but no one's home, it's like you're looking right through them. Think of maybe someone who has been in jail for a period of time, or a drug addict. They're these kind of demons take over them to keep them alive. And what we have to do is we do what's called a dragon treatment. And I'm going to go over that, but we're going to do some points to help to release these demons. So here's an example of a couple of individuals who are possessed. This, for those of you who don't remember Charlie Manson, this is Charlie Manson. And someone else famous, Billie Eilish, I think. Um, so you can just kind of see their eyes are dead, and they may be able to function, but they're not functioning very well. So there's two different types of uh, demons. There's internal and external. So when you're maybe listening to someone's story and you're wondering, should I be suspecting if they're possessed? Look at, as I mentioned, do they have a history of drug or alcohol abuse? Have they been incarcerated? Have they seen some sort of horrible atrocity? People that witnessed 9/11. It's like, I like to think of it like shock, and you're just like Night of the Living Dead, just walking around, and you're not really in control of yourself. You're just going through the motions. And your patients may say things like, I don't know what made me do that. I wasn't myself. I haven't been the same since that happened. Those types of things would maybe make you suspect um, possession. So I actually just covered all of this. You may feel uncomfortable in their presence. And so there's internal demons and external demons. So internal demons um, typically happen from something that is going on internally, some sort of an emotional thing. It's going on within the person, and the way you would treat it is you would do there's a master point a 1/4 inch below Ren 15, then stomach 25, stomach 32, stomach 41, and you're going to go from right to left, top to bottom, straight in, and no needle action. You're going to put the needles in for about 15 minutes, and it's a good idea to leave the room, maybe open a window a little, burn a candle, because when this energy gets released, it could potentially come to you. So um, if they, if you come back in the room and it looks like it hasn't cleared, you can turn the needle like 180 degrees clockwise, and this can help to get that energy out of them. For uh, external demons, this is usually something externally that happens, a car accident, extreme weather conditions, maybe they had surgery, something like that. And the treatment is do 20, bladder 11, bladder 23, bladder 61, right to left, top to bottom. The needles go straight in, no needle action. You're going to leave them in for 15 minutes, and then you're going to take them out top to bottom, right to left. The next so once you have cleared possession, if it exists, the next treatment that you would do, and I do this on every single cosmetic patient that I treat, and it really helps to prevent any like weird sensations, um, lightheadedness, some minor things that can happen with cosmetic acupuncture. But aggressive energy, or AE, is a way to kind of just give a nice clean slate when you're treating your patient. So you're going to put these needles in, and it helps to get rid of any contaminated, polluted chi. Um, and I do this on every patient. If they're not possessed, I do it the first time I treat them. If they are possessed, you do that. You do the possession treatment, and then you would follow it up with an AE treatment. And the way you know if someone has the AE, there's really no way to know. That's why you just do it on everyone, because the test is a treatment and the treatment is a test. So another term for AE is Wei Qi, and this is the evil influence or an unhealthy uh, trend or some sort of pathology. You want to be able to direct as much energy up to the face as possible. And if the person has AE, it is going to block that energy from going up to the face. And it can inadvertently cause that toxic, polluted chi to go other places in the body. So what you do is you are going to put needles in, you're going to put the needles in the back shu points, all of them. This is just a photograph of someone that had AE, but you're going to put needles in the back shu points, bladder 13, 14, 15, 18, 20, and 23. And then you're going to leave the needles in along with these test needles. You'll put in 3 test needles, one on the upper jowl, one on the middle jowl, one on the lower jowl. And if the redness, and they can go anywhere that's not an acupuncture point. So here you can see the redness around bladder 13, 14, and 15. And if you follow this needle all the way down, you can see that the test needle, there was no redness. So this person had a lot of rising heat in their upper jowl. There was nothing on the test needle. And you leave the needles in until the redness clears. So here are some other pictures of people with AE. So this is their neck. And you can see the redness around the needles and no redness around the test needles. Same thing here. Here's their neck. And you can see the redness here, but nothing on the test needle. So again, the protocol is bladder 13, 14, 15, and then you put in a test needle. And then bladder 18, 20, and another test needle, and bladder 23. And you can, you should needle this bilaterally from top to bottom and right to left. You don't put the needles in very deep. You just tap them in so they kind of hang. And if there is AE, you're going to see redness around the needle, which is different than any change you're going to see near the test needles. So that concludes part 1 of why it's important to clear blocks to facial acupuncture. I do have one slide at the end of giving you a sneak peek of next time. My book, Treating the Face, is going to be coming out soon. If you go to my website, facialacupunctureclasses.com, you can sign up to be on my mailing list, and I am going to be taking pre-orders sometime in the next, probably by the end of August, I'll be taking pre-orders. So I want to thank the American Acupuncture Council for this opportunity, and I will see you next time.